Hi, everyone. We are now on session 2 of the CVI course that we're doing. Today, we're going to be looking at causes and identification of CVI. We ended off last time with Gordon Benton, a little bit of a snippet from him. And just because I think he's so good and we do need to understand things about the brain, I'm going to have him, several videos of him, and then we'll continue on with our session. I'm redoing this. We had our session on Monday and I forgot to record it. So you'll be seeing this as it's, try to move things down here. Hopefully you can see everything okay, and we'll get started.
As you will remember from the last lesson, when you place your hands over your head like this, then your thumbs are over the back. They're over the occipital lobes of the cerebrum. This picture shows where they are on a diagram, looking at the brain from the side. The occipital lobes create the picture of what you are looking at. For now, we are going to assume that the person looking has not got any issues with their eyes, although in future sessions we will look at some of the eye conditions that are common with cerebral visual impairment. For those of you who have clear vision, look up and take an imaginary mental photograph of what you are looking at. Your photo or your mental image in your mind has colors, and it's clear in that you can tell things apart, even very small things. And now we come to the more difficult bit, because what we just explained is that the picture is being formed inside your mind. That's where the picture is. We've all been programmed to think that the world is out in front of us. It is, but the picture of it is inside our minds, and it coincides with the world around us. And that is the key to understanding cerebral visual impairment. I now want you to do what we've done in the last 2 lessons, to put your hands over your head again like this. But this time, we're thinking about where the fingers are, the parietal lobes. In this diagram of the brain, the left parietal lobe is marked. The blue left frontal lobe is at the front. With CVI, we are particularly interested in a part of the parietal lobes called the posterior parietal lobes, which means the area at the back of the parietal lobe. Looking at this next diagram, note how close the posterior parietal lobe is to the occipital lobe. They're right next to each other. Remembering the picture from our last lesson? Life is not flat like a photograph. The world we live in has depth. It has 3 dimensions. This part of the brain, the posterior parietal lobes, is the part that makes a 3-dimensional map of the scene so that you can accurately move among the things without bumping into them and reach for things with precision. Look just at the face of the dog in the photo now. You can do that because of another very important part of your visual world. Again, from the posterior parietal lobes. It is called your visual attention. And for some, where it has been affected by CVI, they would find it difficult to find the dog's face. And if found, then find it difficult to stay focused on the dog's face because there are so many other parts of the picture to see. We think of vision as being like a photograph or a picture, but these elements of depth and perception are just as important. This next lesson is about how the brain processes movement. On this diagram of the left side of the brain, the temporal lobe is colored green. The temporal lobes are split into 3 areas. Along the top is the superior temporal gyrus. Superior means the top or highest, and gyrus is the name for the bumpy ridges that make up the surface of the cortex, which you will remember is the outer layer of the cerebrum. Below the superior temporal gyrus is the middle temporal gyrus, and below that, the inferior or lower temporal gyrus. For now, you only need to know the location of the middle temporal gyrus and where it meets the occipital lobes. On this slide, look for the small blue cross at the end of the middle temporal gyrus where it meets the occipital lobes. This is the location of the parts of the brain on both sides called MT, or the middle temporal lobes. They're also called V5. This is where the imagery, which is moving, is dealt with. Hold your hand up like this. And now look towards it, but just straight ahead without following it with your eyes. It's quite difficult. And move your hand from side to side. First, slowly, and then faster still. And as you do this, your detail of your fingers will disappear. And it's the middle temporal lobes that plot that movement for you and enable you to see it. One of the main purposes of the temporal lobes is to store visual memories. Hold your hand up like this and look at it. How do you know it's a hand? You know these are hands because you recognize them. But what is it you are recognizing? Looking at this picture, your brain is looking through your memories to try to identify them. The hands have a shape and a color and are known to be part of the human body. And recognition is so fast that you aren't even aware you're doing it. Your brain has processed the image and quickly searched its files and come up with a match. And that is how you know you're looking at your hands. All the memories of shapes and colors and parts of the human body have their own files in your mind, as does everything you know. And most of these files are in your temporal lobes. Do you know what these are? Most will quickly get that they are horses, and using a similar process of memories of shapes and colors and animals. To know what type of horse they are requires a more detailed knowledge of horses, which some of you may have, letting you know that they are, in fact, Shetland ponies. To make sense of what we can see, feel, hear, taste, or smell, then what we are doing is matching these sensations with our existing memories. It even applies to the words I'm using now. You recognize them. And you recognize them with the store of information inside your temporal lobes. In these lessons, we've looked at the three areas of the visual brain: the occipital, the parietal, and the temporal. These areas we have no control over. It is very difficult to be aware of the parts of the brain that you can't control, because most of the time we are not aware of them. Look at this picture of shoes. What color are they? I can see black, shades of brown, and some yellow and orange detail. The colors are created in my brain, in my occipital lobes, and I have no conscious control over what is produced. So I can't stare at the shoes and make them blue. The shape of the shoe, and that I recognize the shape as the shoe shape from my memory of shapes, is something I can't consciously control or change either. All of the processing we have discussed so far are processes we can't consciously control. But what does consciously mean? And how is it different from what we have described so far? The conscious part of your brain is your frontal lobes, colored in blue on this diagram on the left side of the brain. Looking now at two pairs of shoes, your choice as to which ones you may want to wear is made in your frontal lobes. The picture is processed in your occipital lobes. It's sent to your temporal lobes where it is recognized, and that information goes on to your frontal lobes where you will make the conscious choice based on many things like what you are doing, what the weather is expected to be like, or so that you can choose the most suitable pair This choice is the only bit of the process you are usually aware of, but your brain has been extremely busy processing the information for you to make that informed choice. And if you choose the white shoes, you used your visual attention to find them. And the three-dimensional image map allows you to not just reach for them accurately, but to put them onto your feet accurately and perform the very intricate tasks, like tying the laces. Everything that you are looking at, you are aware of. But the way the brain has done this for you is completely not conscious. It is out of your control. You are not aware of this process taking place, nor can you control it. You cannot make something blue that is red. It is controlled for you by your brain. So if somebody has cerebral visual impairment, then they have a problem with this non-conscious process. And so it is truly a hidden disability. In a previous lesson, we looked at the brain as being like a ship. You can, of course, control the ship with its steering and its speed, but it's supported by many other processes that we have no control over. Let us say that our ship has 6 engines and one fails. The ship is still moving, but it may not be quite as easy to control. Or it may seem a little sluggish. As captain of the ship, you would probably be alerted to the failing engine by a warning light. But how does the brain communicate that something isn't performing quite as it should be when it's in your non-conscious brain? For some, a part of the brain may be severely affected and easy to identify, but for most who are affected by CVIs, it is much more subtle, a bit like losing the power of only a single engine, but without the benefit of a warning light. But there will be signs, and things will be more difficult. This concludes level 1 of this course. But before you move on to level 2, just make sure you've mastered level 1, as this information is so important to the next step.
Okay, I think he does such a great job of explaining things. He is such a knowledgeable man, but he does a really good job of explaining things in a language that I think people that don't have their doctorate in neuropsychology can understand. And so I just really appreciate his passion and his willingness to share his knowledge in such a down-to-earth way. So now we're going to get into today's session of what causes CVI. And the short answer to that is any damage to the brain. The longer answer to that is any of the following and their complex impact on brain and visual function, such as asphyxia, and that's when the brain is deprived of oxygen, hypoxic ischemic encephalopathy, otherwise known as HIE. Okay. And that's like a little brain bleed or some kind of a stroke that's happens before a child is born, that affects their brain. Periventricular leukomalacia, I don't know if I'm pronouncing that right. Intraventricular hemorrhage, there again we're seeing bleeding. A cerebral vascular accident, or a CVA, otherwise known as a stroke, and this can happen at any age. Any kind of cerebral trauma, accidents, shaken baby syndrome, traumatic brain injury, recurrent concussions, central nervous system infections, otherwise known as TORCH. It just encompasses a bunch of different things that can happen to the brain through infections. We can also see encephalitis or meningitis, brain tumors. There's just anything, as you're looking through your kiddos' case histories, and you see things in their reports that would indicate any kind of affect on the brain, take note of that. Does that mean that they're going to automatically have a cerebral vision impairment? No, but it does definitely increase the chances of that. We also might look for syndromes of any kind, Bayes syndrome, Down syndrome, anything like that where there's maybe a metabolic disorder or some kind of chemical imbalance that's going on that can affect the brain. That can be a flag. So we want to know 3 things kind of about that insult or injury to the brain. The first one is the timing of it, when it happens. Is it in the womb before the child is born or as it's born? There's where we get those very premature babies, or maybe it happens before the child is even born. It could be shortly after birth. During early development, after birth, but maybe there's a drowning accident or any kind of infection that might happen that could cause damage to the brain in early development. Any injury that's acquired in the developed brain, and that's a child or adult. And there again, we see closed head injuries, we see shaken baby syndrome, we see stroke. Again, something like drowning or a car accident, things like that. Then we need to find out, okay, when has it happened? Because that kind of will tell us a little bit how that injury is going to act. And then where does that injury take place? We talked about the occipital lobes, which are in the back of the brain. Dr. Dutton talked about that. The frontal lobe is here where we have our executive functioning, in the very front forehead part of your brain. And that's where you make your judgments, your reasoning, your decisions. The parietal lobe, which is, if you saw, he talked about that X that's really close to the occipital lobe, where you sense movement. The temporal lobes on the side, and that's a lot of your visual memory, and where you store images. The cerebellum, which is the brain, the interior of the brain stem. And like anytime we see insult to the gray matter, or especially to the white matter of the brain, there is that chance for it affecting how the brain is going to perceive in terms of vision. I'm not advocating that everybody needs to run out and buy this book, but this is one of the books that I found really helpful in understanding more about cerebral vision impairment. It's written by Dr. Dutton. He does a very nice job of explaining things in language that's understandable. The counterpart to him, Amanda Hall Leake, Dr. Leake, is also very well versed in this. And it's Vision on the Brain and Understanding Cerebral Vision Impairment in Children. And it's through the American Foundation for the Blind, otherwise known as AFB Press. And there's just a lot of really good information in there. All right, so how is CVI identified and diagnosed? Okay. Well, as you can imagine, the people that probably first notice that there's something going on with their child is the parents. Parents are often our best sources of information. I think any of us that are parents would probably say, yeah, I know my child pretty well. I think I know that child as well as, anybody does, at least, especially when they're babies and you're with them all of the time. The parents are the ones that are taking the kiddo home at night. So it's really important to listen to the parents. And then we have, of course, educators. And the more we become educated, we're going to be better at spotting where there might be something going on that we are just not quite knowing. Therapists are a great asset here in helping identifying. We've got our occupational therapists, our speech language pathologists, our physical therapists, CODAs, COMS, the orientation mobility. there's just a lot of different ways that a child um, can be seen in a certain setting or context that might give us clues. And then medical professionals, of course. A medical diagnosis is the only way that CVI is diagnosed. A TVI, or teacher of the visually impaired, or a teacher or a psychologist cannot give that diagnosis. And so how does that diagnosis come about? Well, we're hoping, by educating and getting the word out, that as we see kiddos who are starting to display certain visual behaviors, that we gather information. We can't recommend that a parent takes their child to a neurologist, but as that parent is asking questions and we're gathering information, generally the parents are like, oh, I think we need to check into this further. And that's how that child can be seen. And the neurologist, an ophthalmologist, or a neuro-ophthalmologist. Now we have just a couple of those in North Dakota. We have more neurologists, but just a couple of neuro-ophthalmologists. One of the reasons that North Dakota is kind of behind the 8 ball in identification and knowing about CVI is we just don't have the medical personnel who really have been trained, and that's beginning to change a little bit. And then as information is brought to them and they see kids, that increases their knowledge as well. So CVI is often first suspected by parents, caregivers, educators, or medical professionals. It's one of those things where something doesn't seem quite right, but you can't put your finger on it really. And maybe the child is looking kind of through people, is making very little eye contact. The child does not seem to recognize faces, maybe not recognizing shape, or maybe not understanding where their place is at in space. And the child does not seem to understand what he or she might be seeing. They're seeing something, but they don't know what it is. So when should CVI be considered? There again, you can have, and that's often the case, there's a normal eye examination, but it doesn't explain how the child is using their vision. There is not a correlation there. It doesn't match up. We're like, gosh, they just took them to the eye doctor and the eye doctor says that this child's eyes are, functioning normally. Okay, that's an ocular type of thing. We talked about that in the last session. That's not the same as a brain-based or cerebral vision impairment or cortical vision impairment. And so maybe the child, is seeing things, but really not understanding or not able to tell you what that is. And so there's a disconnect there, and that kind of starts to become more noticeable. If there's any history of brain injury or neurological difficulties, that's another flag. Or the child presents visual behaviors consistent with CVI. And we'll get more into that the next session about what those visual behaviors look like and how we know what those characteristics are. But if you see kids that are doing things, and that's often the case, it's pretty easy to maybe tell when a child is at a lower functioning level with CVI, but the kids that often get missed are those who, are functioning at a higher level and they've already learned to compensate. We had a case study that we learned about in my class where there was a 15-year-old boy, and very, very bright. And his mom had, I think there was some kind of birth trauma, but they really didn't think much of it. Anyhow, this child actually was seeing in words. It sounds very strange. It's hard to wrap your mind around, but the mom and the child, as he was 15 years old, they were sitting and looking through some slides on the computer that she had, photographs. And there was one when he was younger and he was sitting on his uncle's lap. And she said, she normally would just kind of narrate and be talking. But at this time she said to her son, oh, and who do you suppose that is? And the son looked at her and said, really, Mom? How would I know? And she's like, you don't know who that is? You don't know who that uncle is? You don't know that who that, that yourself? And he's like, I have no idea. He didn't recognize faces. And there were other things that he didn't see normally either. They ended up taking him it was quite a journey that they went on, but they ended up in Paris, where there was a very specialized test that did like a heat sensory type of thing, picture of the brain. And it showed that apparently because of some anoxia, deprivation of oxygen at birth, he had certain areas of his brain that they were black on this, and his brain had compensated. It had laid new pathways, but there were certain things that he couldn't do. And so he recognized, for example, his mom in words. He knew about that from her being blonde, her being tall, by recognizing her voice. And so those were the ways that he had compensated. So he was seeing in words, really not putting the whole picture together. Okay. A diagnosis can only be given by a medical professional. A medical evaluation needs to be done by, like I said, a neurologist, an ophthalmologist, a neuro-ophthalmologist. Now, generally, they'll see something on an MRI or a functional MRI, but these two may be normal. There's different kinds of, like I just explained about this boy, he underwent some different kind of brain scan that did finally show where the deficits were, but it can be extraordinarily difficult to diagnose. So now we're going to go on, and I'm going to have you watch a few more Gordon Dutton videos, just because I think they're really a good baseline or a good foundation to know when we're talking about CVI.
Before we start talking about how the vision works in the brain, I think what we must first focus upon is how the brain learns. All that knowledge, how did it get into our heads in the first place? Not through teachers nor schools, but all the time we're learning. All the time it's entering our minds, and we are picking up the information and remembering it. It's that picking it up, it's that remembering that we want to consider now. Newborn babies can do very little for themselves. Try to think of the things you've been taught to do and learned to do since you were a newborn baby. To understand these words, you have not only learned to read, but you have also learned language, and of course, probably to talk. If you are sitting, you would have learned how to sit, but were probably too young to remember. Think of something that you have recently learned to do, maybe a sport or a hobby, or cook something new, or a subject you are learning about, maybe even cerebral visual impairment. Virtually everything that you have learned, virtually everything you have learned to do has followed a pattern. It's followed the pattern of having an experience, remembering that experience, and then later recognizing that experience. 3 steps: experience, memory, and recognition. Of the 3 elements, experience, memory, and recognition, what does it mean to experience something? To experience something in terms of your brain means that one or several of your 5 senses is alerted to the presence of something. That doesn't sound very personal, does it? But that is how our brains connect with the world around us, through our 5 senses. This child is experiencing the butterfly by looking at it and feeling the touch of it on his hand. His experience of the butterfly is visual and tactile through touch. But just because we experience something does not mean that it is a learning experience. Look at this board. You may be able to see all the information clearly, so you are technically experiencing it. But can you learn from this alone? Some can, but many can't. because experiences to be learnable need three parts. The experience needs to be perceivable. That means that it must stimulate and be accessible to at least one of your senses. The experience needs to be meaningful, and the experience needs to be motivational. We are going to look at these three parts separately in the following lessons and explain what they mean. So what is a memory? This is a complicated question, but it's very important to understand. In level 1, we looked at the structure of the brain and explained that the outer layer of the cerebrum is called the cortex, or the cerebral cortex, and this is made up of grey matter. On this MRI image of the left side of the brain, the grey matter covering the outer side of the cerebrum, that is the part that looks like a cauliflower or walnut, is clearly darker than the lighter white matter that forms the center of the cerebrum. The grey matter is made up of neurons and other brain cells. The white matter is made up of bundles of connecting neuron or nerve fibers. The neurons are particularly important because as they activate through sending electrical signals, they make the interconnections necessary for your brain to work. Your memories are stored in these neurons, in the cortex of your brain, and mostly in or around your temporal lobes. Your temporal lobes can be thought of as great libraries where your knowledge is stored as memories, or as your wall of knowledge, each brick representing a memory. It all goes back to the brain. You experience something, as we have explained, and the brain will try to remember it. And that memory has a place in your brain, and there is an order, a bit like a library, so that you can find things more easily when needed. Memories are formed as a result of experience. And as each experience takes place, it becomes integrated into memory, and that is how we learn. This lesson is about recognition. Here's a mug. How do I know it's a mug? I know it's a mug because I can detect its shape, I can detect its color, I know what it will sound like, I know it's hard. And how did I know all this? Because I recognize the cup. I know because I have taken in the picture, I have seen every element of it, imagined every element of it with my memory, and matched my experience of the cup with my memory. There are two parts to the recognition process. The first part is a matching process, a little bit like a children's game of Snap, where matching cards are put together. As with the lotus flowers, having experienced one flower, when you experience another, if it is similar enough to the one in your memory, you will get a match. Snap. They are the same, but not quite. But the brain is much more clever than that. You could be walking along a road, looking ahead and past someone you haven't seen for 10 or 20 years. You may not even be looking at them, but your attention can be drawn to them as someone familiar, perhaps by the way they are walking, the way they are moving, matching a fleeting glance with your memory from the distant past. Snap. The match alone only tells us what two things are like. It doesn't tell us what they are. We've used the example of this lotus flower often in these lessons, so you probably recognize this picture and know that it is a lotus flower immediately. But what if we hadn't given it a name? You might think it is a type of flower, so let's take out that word too. So what is it without words? Most people use language as a key part to the recognition process. Whatever you are looking at or listening to or hearing, smelling or tasting, you match with something and recognize it with some form of label, mostly using language, using words. Try to look around you and make sense of what you can see without using language. whether it's language in your imagination or language which you then speak.
All right, I just think that's so helpful to listen to him, and when you have this on a recording, then you can go back and if you want to, but there's so much information on this website. It's listed as cviscotland.org. That's CVI, the country Scotland.org. You can go on there and look under resources, and he's got lessons on there. It's just a really, really good, way to educate and get more information on this subject matter. So what do we need to know about children or adults with CVIs to learn to understand their world and to see their world as they do? Okay. So first of all, we would like a full list of the person's individual cerebral visual impairments. We may or may not get that. Oftentimes in our area, we're just at the very beginning of that stage of wondering, does this person even have cerebral visual impairment? But when we're seeing those kinds of flags that I talked about just a little bit earlier, the causes, we start to put that together and put the puzzle together, and especially then getting that information to a medical professional so that there can be a diagnosis made. That really is key and helps everything, because then we can get that into the child's IEP and start making accommodations and modifications, with that. Second is the severity of each impairment, from mild to most challenging, and how each one limits the person's access to their world, affects their interpretation of their world, and impacts upon their learning. So talking about access to information, interpreting or perceiving, and then how that impacts them learning. 3, the situations that may make each impairment better or worse, which might be environmental. Okay. Maybe it's external, like how does that child act, where if they're in a quiet location versus somewhere that's busy, someplace that's crowded or noisy. Internal, how is that child feeling? Are they happy? Do they seem bored? Are they in discomfort? When you start noticing that, then you can start kind of getting a better idea of how is this child seeing the world? Continuing on with that, 4, we want to have details of other neurological processing difficulties. For example, how sound is processed, if there's a cerebral auditory impairment. And yes, there can be hearing impairments that are cerebral, the same as, the visual kind. How timing is affected. Is there really slow processing that needs to be matched? We need to wait. I'm going to give an example right now of classroom teachers, and we've talked about this before, or any of us, I guess, that teach. When we ask a question, we are generally expecting an answer probably within 4 to 5 seconds. And a lot of these kids with cerebral vision impairment need probably more like 15 to 20 seconds. So let me just give you an example of what that was. I'm going to ask a question. What is the answer to 16 plus 14? Right about now is when I kind of expect to have an answer. But with these kiddos, I'm going to keep going and I'll show you where. It's about here. That's how long we would be waiting for an answer. And that is a significant difference. It seems like a very long time when you put it into that context. How is that person understanding the result of an understanding of the resulting behaviors, which can include adapting to difficulties? So one thing I didn't realize when I started taking these classes, and it makes sense now, but because processing is so difficult, a child often cannot look at an object and listen at the same time. So they might look at an object, look away, they're processing it, and then look back. Okay. It's maybe so much information just to be looking at something that they have to look away in order to process it. That's another explanation. Reacting to circumstances, such as being fearful of busy places or having a lot of anxiety because they don't want to go someplace new, or not liking to go to the grocery store, or, not being comfortable with new people because they can't recognize people the way that other kids do. And then not responding because they're just not perceiving. They're just not understanding. And so there's just not that kind of visual curiosity. Okay. 6, an understanding of how their emotional, intellectual, and social development may have been affected. 7, an understanding of how these factors have been affected and how they are affecting their learning to this date. To have an understanding of any difference between the person and how others of a similar age are developing, like in terms of learning the behavior, independence, and social skills, and then comparing those and starting to kind of profile and say, oh, this is another part of the puzzle. This is making sense. I can see where there's a discrepancy here. Looking at other medical conditions that affect the person. And 10, whether the CVI was present at birth or very soon after, or if it was acquired in childhood or later. And there again, we're going to see different kinds of behaviors or different kinds of vision, as we'll learn more about in the following sessions, because of the timing and the location and the severity. So we're going to look at this. Think about a child that you maybe are in your caseload that you're thinking about, and you're wondering, wonder if this child might have a CVI, or what am I supposed to be looking at? And this to me is very helpful in trying to discern some of that. So let's look first at the past. The past is full of priceless knowledge. In reflecting, think about the times when that person or that child, your student, has been the most happy. Think about the circumstances, if it was quiet in the room, if it was, when they had accomplished something, and, that was a breakthrough for them. Maybe when that child has been most distressed, when are they acting out? Something that really surprised you, that child did something that you thought was way beyond them. Or conversely, surprised you because you thought that was something they should be able to do, and they just didn't seem to be able to do it at all. Okay. Think of a time when that child seemed really focused on something. Now, again, when we talk about CVI, it's often been diagnosed, keep that in mind, as maybe a behavior problem, maybe as autism, maybe as ADHD. These are things to start thinking about, and differentiating between that diagnosis and maybe what the CVI diagnosis would look like. Think about when that child seemed most distracted and difficult. And then for each of those times, like I said, think about the physical environments that they were in, or the people that they were with. Was it with somebody familiar? Was it with somebody that, has a quiet voice? Is it somebody that, looks like their parents? Those types of things. Think about what they were doing at that time, or anything else that seems relevant. See if you can come up with any common themes that explain how and why the person behaves the way that person does. Where the CVI was acquired, like in a shaken baby syndrome situation or stroke, consider the skills that person had before that happened to them. If they were a baby, maybe they had started developing normally, and then this event happened, and so they had acquired some skills. They might have regressed in those skills, but now kind of how have those skills changed? Are they still intact? Are some still present? And then we think about the present time. So as educators, right, our starting point, we need to meet that person where they're at now. not where someone else or some chart or some statistic says that they should be. Okay. We all exist in the 4 dimensions of time and space. So what you know from the past through 1 from 9 from the previous slide, how much time do you need to allow that child to process? Okay. Again, just think about the little example I talked about of giving them up to 15 to 20 seconds to process, a question. Or, to if you're doing a project, how they can chunk that up or compartmentalize and how much time do they need to be able to do that? Think about how fast or slow things need to be moving in order for that person to see them. Oftentimes, movement is a key factor in a CVI, and um, just that's something that's really um, to be thought about and to be noticed. How big or how small do things need to be seen? Now, oftentimes when we think about vision impairment, this is the key thing that all teachers, all of us kind of initially, think about is their acuity. How big do things need to be for them to see it? If I can just enlarge it, does that make, that should cure the problem. Um, a CVI is not the same thing, remember, as an ocular impairment. Okay, so in terms of being big or small, sometimes it's complexity. Um, how spaced out do things need to be? By nature, if something is bigger, if that font is bigger, it's going to seem more spaced out because it takes up more of the page and there's not as much in the viewing area. So maybe that's a key. It's not necessarily that they're not seeing an item, but that there's so much being presented at one time on one worksheet or in one film that they're just not seeing anything at all. So we kind of step away a little bit from the acuity part of it and just thinking that magnification and that type of thing will fix everything, to let's look a little deeper. Let's see how complex we're presenting things. How are things heard? Is quiet needed to hear? Is a student especially attentive to one kind of a sound? And remember, this is applying to kids from all, to the lowest functioning kids to the highest functioning kids. So it's a very broad range. So these are kind of questions that you can apply to each specific circumstance as it's appropriate. What environments help the person see, hear, and experience the world most clearly? How many things is this person able to process at once across all the senses, not just, our 5 senses, but also think about vestibular, the movement, our area and space, that kind of like extra sensations that we have, balance. How do those affect, and can a child, like we talk about kind of the old adage, can you walk and chew gum at the same time? But are kids able to do more than one thing at once? How are their other senses affected? Maybe they're hearing something really well, but they have to close their eyes in order to hear well, or maybe they have to really stare at something in order to hear it. How is their mobility affected? How are they getting around? And this is where it's great to have maybe an assessment of an orientation mobility person come in, or somebody who watches them navigate the school. Is anybody noticing any strange things, like they're stepping off the curbs really weird, or they're bumping into things that, other kids are seeing, or they're tripping on something on the ground because they're not seeing it, or on the playground, they're just not, noticing when a ball is coming at them. And then to try to make everything as accessible and perceivable for them. So we also want to try to make everyone else make everything perceivable for them. That is, we want to generalize this. We want to get this so that it goes throughout their whole environment, at school, throughout the school, the lunchroom, the classroom, the resource rooms, the gym, the music room, as well as their home environments or on the bus, so that things are starting to make more sense. And then finally, we want to look at the future. You know, plans need to be organic, they need to be authentic, they need to be something real. And so it needs to apply to that specific child. We've said again, you know, when you see a child with CVI, you've seen one child with CVI, it presents differently in every kid because our brains are all different. When that child is developing, the plan needs to maybe change. Everything does change. And so plans need to be reviewed and re-reviewed. Okay, maybe it needs to be done more than once a year. These are things that just make it a team and a collaborative effort. That's so, so important when we're working with kids with CVI. It really does. It takes a whole team to really help provide that child the access to the environment and the access to learning and the ability to be able to recognize and perceive and to learn. Then consider the person's needs relevant to them in terms of their learning and education, their independence, how doing more for themselves and taking more control of their life and decisions, how can that happen? And then look at their social relationships and interactions. You know, oftentimes people with sensory disabilities, deprivation, become isolated and lonely. And so we don't want that. We've even seen, like with COVID, people are social creatures by nature. And so isolating is very difficult. And when a person feels that they're isolated in their own peer group or in their own environment because they're not being understood, that's especially challenging. So that is the conclusion for this session. And then our next session, we're going to start looking into the characteristics of CVI and more so how to identify visual behaviors and some assessments that go along with that. So thanks for your time. Hope you guys have a great week. We'll see you next Monday. And then Easter Monday, we will have off.